Hello and welcome to In Conversation with the history holders of the American Dance Therapy Association, a project made possible by the Marian Chace Foundation. My name is Dr. Jacelyn Biondo. When I first conceived of making these videos, I hoped to capture the words of the women who studied with the firsts in our field: Marian Chace, Trudy Shoup, Mary Whitehouse, Alma Hawkins, Blanche Evan, and Lillian Espinack. What culminated in the process was an opportunity to have these women share their stories and their memories in their own words, and to capture these parts of history for future generations. Thank you for joining us, and I hope you enjoy our conversations. Hi, Dr. Nitza Broide-Miller. I'd like to welcome you. Thank you so much for talking with me today.
You're welcome. Hello.
Nice. Hello, nice to see you. So I'm really excited that you've agreed to be a part of this project. You have just what seems like a wealth of knowledge and experience that I can't wait to hear about, and I'm sure others cannot as well. So we're gonna get started with the first question. If you could just share a little bit about with whom and where you first started studying dance therapy.
I started dance therapy in 1963. The first course that I took was with Marian Chace in New York in Turtle Bay Music School. She used to give a course once a year in June for 3 weeks, which was 1 week, it was all didactic and preparation. And the next 2 weeks was practicum. So we basically went from one mental hospital to another and did the work. So it was very, very intense. I was the only foreigner in that particular course. Everybody else was American. So it was quite a challenge for me to speak in a second language, which I knew, but you know, it was much more challenging to go and do whatever we learned to do in the hospitals when everybody else was kind of flowing with their own language. So I did the course with her after a big search because there was nothing else. And after the course, I realized I definitely need more practicum in order to be good at it. So Marian invited me actually to stay with her in Washington, D.C. And she and I went and stayed with her for about 2 months in her little apartment and went with her to work every day to wherever she went. So I basically followed her, and sometimes she asked me to do something, but most of the time I was observing her and learning from her. So she was my first mentor. And I think that up to now, including what I have developed afterwards, you know, I'm using her basics the most in the dance therapy that I'm doing, which is very different than what I did with Marian Chace in the hospitals. So, and the other person that was most impactful for me was Trudy Shoup, that I trained with when I moved to California, which was many years later. And I had a baby, so I couldn't go to Los Angeles to train with her. So I basically organized an intensive workshop that she came up and stayed with me in my home. And I got a whole group of people together. And for 8 days, I had nothing but Trudy Shoup to myself, which was really wonderful. So there was 8 hours training, and then she stayed with me at home. So I had more chance to pick her brain and talk with her and discuss and learn more from her. So I also met all her family, which were all artists, you know, they all worked together. So she worked very, very differently than what I learned from Marian Chace. So it was a wonderful opportunity to combine the things together. The third impact was, for 12 years, I worked mainly in mental hospitals with mental patients and in psychiatry and with music, always used music. And in 1974, I discovered there is a summer intensive course in UCLA that Alma Hawkins organized. And it was every day for a whole month in the summer. So I applied and was accepted. By then I was living back in Israel, where I started dance therapy, because dance therapy didn't exist in Israel either. And I started everything there. And I flew to UCLA and took the course with Alma Hawkins and the rest of the people. It was half a day didactic and half a day movement, but Alma worked completely without music. And that threw me into complete confusion. And I didn't know how to combine these two things. And usually when I learn something new and I'm not sure how to internalize it and integrate it, I usually give myself time until it comes from inside. So afterwards, I was doing workshops in Esalen Institute, where I started developing my own way of movement therapy, not necessarily with mental patients, but with anybody who participates. So the other woman that I experienced a little bit, because she did not move a lot, is Mary Whitehouse, because she had MS and moved from Los Angeles to San Francisco, which actually gave me an opportunity. I said, well, Mary Whitehouse is here. She was on a wheelchair. By then she could not move. I met her previously in New York for a 1 or 2 days workshop. So I decided to go to her for private sessions to see how she works. So I drove to San Francisco every week to work with her, and she basically worked with me. And I did it in order to see how she works, coming from her Jungian background and the way she was working, even though she was on a wheelchair, which was totally admirable. So these were the main forces that came into my life. Yeah, and I appreciate each one of them in a different way.
What a unique experience to have had an opportunity to learn from 4 of the different women who were doing dance therapy at the time.
Yeah, in very different ways. Yeah, yeah.
Can you speak a little bit about what drew you into the profession?
Well, see, I was dancing all my life. My mother said when I was 3 that if music started, nobody could hold me down. So I basically was hopping and jumping and whatever. Formally, my mother signed me up in Israel, there was only ballet at the time. So I studied ballet. Then I discovered modern dance. And later on, when I was already, all the years I danced Israeli folk dancing and performed and choreographed a lot. And then West Side Story came to Israel. And that changed my life completely, because I was totally triggered by the whole rhythm and by jazz. And I had the same producer in Israel for folk dancing as he brought to Israel West Side Story. So I asked him permission to attend all the rehearsals. So he said, okay. So I sat in the theater every day, all day, and watched it and decided I have to study this. And this didn't exist in Israel. So I flew to New York. I basically moved to New York and went to June Taylor School of Dance, where I was on a student visa, and I studied everything there. It was ballet and jazz and modern and African dancing, everything, all the kind of different forms of dancing, which was absolutely wonderful. And jazz became very powerful for me, because when I went back to Israel from New York, I basically started teaching jazz. And this was definitely part of my soul. Yeah. So, yeah. And why I wanted to be a dance therapist, because there was nothing else to do other than teaching. And I was teaching dance since I was about 15. And I realized that if I don't want to just have a studio and keep teaching, choreography at the time was not a possibility, other than I did some choreography in my youth movement and with my friends. And theater musicals were not in existence in Israel at the time. So there was no outlet for that. And I wanted to do something with movement that is more personal and more psychological. So I basically flew to New York, and there was no dance therapy, but I decided I have to search. So I just took myself to New York and started searching. So I'm an explorer. So
And then do you want to share a little bit about how you came across Marian Chace? I believe that was your first person that you connected.
Yeah, so I looked in the phone book when I got to New York, and in those days there was no internet. So I went and called every single college and every single school in New York and asked them what kind of programs they have with dance. And nobody had anything. Some of them had a dance program, which was not what I was interested, because I already was in June Taylor School of Dance and I was very happy there. And finally, somebody said, oh, there is a Turtle Bay Music School, and Marian Chace comes once a year to give a 3 weeks intensive course. So I applied, and in those days, you know how we had to apply. We had to write our autobiography by hand. And they sent it to somebody to analyze our handwriting. And this is how they decided whether to accept you or not. So I have no idea what they saw in my handwriting, which was, of course, in my second language, English.
Right.
He never analyzed my handwriting in Hebrew, which is my maternal language. And I did not have the sense then to ask, how are you deciding to accept people based on that? What does it show? Which I'm still curious about till now. So I have no idea. So I was accepted. There were 12 people in the course, 12 women, all American, one lady from Texas, which I couldn't understand a word she was saying because of the Texan accent. Only later on, I learned from some participants that they couldn't understand her either. So I don't know, I couldn't understand a word she was saying. And I sat down and my English was pretty good, but every time I wrote a word I didn't know, and in the evening I would look up in the dictionary because I was embarrassed to ask, you know. So this is how I found it. I wanted to do something with movement that is more psychologically oriented. And I didn't know what to call it, but I knew what I was looking for. Yeah.
Kind of this innate knowledge that something must exist with movement that doesn't quite have a name yet until you found dance therapy and thought, oh, that's what it is.
Yeah. But I think, you know, I was a certified teacher before. And when I was teaching first and second grades, I learned very quickly that I'm not interested to know if the kids know how to read or if they know how to do math. And I realized that I really was more interested in the children's development. So I really became aware that the psychological elements are more interesting for me. So that applied also to my work in dance, you know. So, I mean, I just like to dance for dancing also, but to use movement and to use the body to allow yourself to express and find who you are is wonderful, is extremely important because there's so much information in the body.
Thinking about all of these wonderful experiences you had, perhaps a little bit about each or about the ones that were most meaningful to you, but I'm wondering if you could just share a little bit about your experience studying under Marian Chace, Trudy Shoup, Mary Whitehouse, Alma Hawkins.
Yeah, I'll start from the end, you know. Mary Whitehouse was very Jungian, and the way she worked with movement applies more to what we call now authentic movement. And I never focused on authentic movement, but I enjoyed her teaching and I enjoyed her training, and I did it, and it was very meaningful. But it was almost like allow your body to express itself. Also, when I went to see her privately in San Francisco, I had a private session with her one time. She said nothing. She told me to choose the music. She was on a wheelchair. I chose the music. I danced. And at the end, I basically became aware of something that happened in my body. I had a shoulder pain for a very long time that all the verbal therapy didn't help me to get rid of it. And at the end of that session of dancing by myself to that music, I ended up laying on my side on that right shoulder. And all of a sudden, it came to me the meaning of this pain and what this pain was telling me. And the pain went away after one session. So it was unbelievable. And I made the meaning. She didn't say anything. She said, how are you experiencing yourself? And I said, the pain is gone. And I know why I have pain in this shoulder, why I had pain, because that pain never came back, never. So I had a very difficult time in my marriage at the time, and it had to do with that. And it just went away after one session. So I said, there's so much power in the information from the body, So that was with Mary Whitehouse. With Marian Chace, I think I still till today use the basics of what she was teaching us. She focused on teaching us to observe the body. And whenever we asked her, shouldn't we go to university to study psychology? She said, no, you don't need to study. You don't need any degrees. All the information is in the body. You just need to learn to observe. And that leads me till today. This is how my whole work, even though I work differently than Marian used to work, but my whole work is starting from observing the body and picking up whatever clues, whatever movements come from the body, even a small little movement like this, very, very tiny, and developing it. So this is what she taught us. She taught us to observe. She taught us to pick up movements, even the smallest movement whatsoever. And then she worked with us on developing the movement to be more inclusive in more parts of the body and more expressive. And then we had to develop it to a way that it becomes meaningful to the person. And when I was training people in dance therapy several years after, the most difficult part for people is not even to pick up the movement, which is very artistic kind of ability, but also to develop it and to find meaning on the movements that the body gives you. This is the most difficult thing that people had to do. The other difficult thing was to choose the correct music to match with the person's condition and with your voice and with your tone and with the rhythm that you are developing. But still till now, when I start a session, I always start by warm up and people move around and I begin to pick up things very, very little. And I like working with groups. So it's quite a work of art, how and who to pick up from, because some people are faster, some people are slower. And how do you pick up from different people and little by little bring all these movement into some balance and harmony so the whole group can move, each one in their own pace and their own rhythm, but still have their own individuality, but still moving with the whole group together. And that's I think took me years to develop to be able to do. Because I usually got feedback from the participants and they said, I felt that you are only talking to me. And I don't move with the people, I facilitate it. I move in between the people to facilitate, because then I pick up the energy in the room. and I like to work with the energy.
Mm.
So that's what I learned from Marian Chace, and I think this is till now a very basic of what I'm doing.
Mm-hmm.
And it really fits what you learn in psychology too, because you have to meet the person where they are, and you have to be able to assess if they're ready to move anywhere, whether it's movement therapy or verbal therapy. You have to pick up, because if you go too fast, people just rebound, back. The danger is the rebound because they're not ready to open up. So the body is a very, very sensitive instrument, and it's very important to allow the body to develop and open slowly in its own pace, in its own willingness, in its own readiness to let you know what's going on inside.
Mm.
And from Trudy Shoup, what I learned is her combination of movement and pantomime and theater, which was her training, was very appealing to me, because I was also in theater since I was 13. So, and I took mime at the university.
Mm.
So all the combination, what Trudy emphasized always is working with opposites and intensifying what the person can have. And she used to push the people, not in a bad way, to encourage people to go deeper and deeper and deeper and louder and louder, and have more and more of body parts join, until the whole person is kind of almost like in a trance. When I did the workshop, which I organized with her, it was wonderful, because we took people's stories of their own life, and people chose other people to play roles, and we did it all in movement. And later on, when I trained very deeply in Virginia Satir's work, who did family reconstruction, where people chose other people to play roles, it was I did it in movement before, but when I started training with Satir, it became also with the family reconstruction that people chose other people to play roles. So it wasn't in dancing, but it was very similar to what Trudy Shoup did with us in the workshop, and it was very, very intense and very meaningful. Yeah, and Alma Hawkins for me was much more organized, much more structured than I was. And with her, for a whole month in UCLA, we didn't use music. So that confused me completely. And that confusion was wonderful, because now I sometimes use music and sometimes I don't use music. So little by little, I integrated it, and I'm doing it as is required by whatever is happening in the group.
In your responses, you kind of merged two of my questions together, which is great, before I even asked it. So we were talking a little bit about your experiences, but also, the next question was, what about their teaching stood out to you the most, which I feel like you've touched upon quite a bit. Is there anything else maybe about their style or their personality through teaching that you'd like to reflect upon?
Yeah, it's very interesting you ask about personality, because one year in the conference of ADTA, they had a panel about Marian Chace, and a lot of the people who were chosen for that panel, which I don't even remember the names, but I wouldn't name them anyway, they had horrible experiences with Marian Chace. They always talked about what a harsh woman she was and how difficult she was. And I was sitting in the audience listening to this panel, and that was not my experience of Marian Chace. I mean, I wanted to study, I wanted to learn. So I did not come there to participate with her to worry or wonder about her personality. I just took in whatever she could give me, and I worked with that. And even when I stayed in her house, which was a very limited, tiny little apartment with nothing much in it, you know, and followed her for 2 months working with the most difficult patients that you have never seen, which was amazing. And I could see the emotional connection that she had and how she would approach people, the patients, who were so scared because they were so disconnected from their body. A lot of them with dissociations, a lot of them, this is before medication was even existed, you know, and she could make connection with anybody. And I have never seen somebody refusing to her when she reached out to them to invite them to the circle. You know, so I experienced her as so inclusive and so allowing and so patient and going step by step based on what the person is ready to be. And if she would go by someone and invite them and they wouldn't come, she would just continue to go around the room to invite the patient. And in the second time, maybe the person would come. And if not, the third time the person would come. And eventually everybody was up, you know, and everybody was accepted. And I think this was so touching to watch the softness and the allowance and the acceptance of everybody wherever they were and giving them the space and the room to participate when they were ready.
I love that you mentioned that about Marian Chace, because it just speaks to the importance of, if somebody says no, it's just in that moment no, right? And if you make time and space to circle back, then they may say no again. But if you continue with that welcoming and that encouragement and that just authenticity of self, then eventually people will join when they feel ready. And it sounds like that was really a lot of what Marian had expertise and was really attuned to.
Yeah, but you see also, it depends on how do I reflect on what is the meaning of no. If I take it as a rejection, it's a whole different story. But when a person says no, you know, when children are about 2 years old, we call it terrible twos. Why? Because they learn to say no, because they need to learn to know where their boundary is. And being able to say no is actually a point of strength. It's not a rejection. It's especially when somebody is already as a mental patient that is totally excluded from the world in these horrible hospitals, if those days especially, you know, if they're able to say no, this is a point of strength. This is a point of boundaries. This needs to be respected. This needs to be welcomed. You know, that the person knows that. And I know there is one of the articles that I like the best is the article by Judith Greenberg that she called Miss Chace and Me. And she says there that what do we think as dance therapists, that we come into the room and everybody can take our body? And she writes there much better than I can express it now, you know, that after all the medication or even no medication, all we have left is our body, you know, because the mind was completely confused. And at the time, there was very little knowledge about the brain and the neuropsychology and what the brain can do and how people became dissociated. And all they have is the body. And you want to take that away from me? Our job was to allow them and invite them to create a connection, because everything starts from the body. Just like all the development of a baby starts from the body, not from verbal, from the body, from sensation. So we need to encourage them to sense the body sensation and begin to feel alive again with all their senses. This is our job, really.
Can you share maybe one or two of your fondest memories about becoming a dance therapist, the studying and the practice?
Yeah, I don't have any specific thing, but for me, the learning to observe the body and take from very small, minute movements and allow them to develop, and going inside and finding some meaning into all these meanings and allowing these people to open up more and more and more. Because most people who are psychologically limited, they usually are very constricted with their body, you know. Some of them walk without moving their arms even, you know, and some of them definitely don't open up wide. So to watch somebody who is so stuck in that position and is so afraid and so fearful, to allow themselves to open up and kind of take a breath and have a sound out of their body is so exciting for me. I actually have one of Trudy Shup's tapes that she works with the patients, and she is encouraged the person to open more and to open more and to have a sound more. And you watch the person's face and all of a sudden they start smiling, which, you know, these patients, they lost their muscles of smiling. We have in the face special muscles that are responsible for our smiling. And they have been so miserable. And to watch these people all of a sudden smile and look at you in eye contact, this is, to me, is very, very exceptional, is very exciting, you know, to accept the body, because if it all starts from the body, you know, and if the body feels like dead and you have no sensations and you don't listen to your senses, whether it's hearing or seeing or smelling or tasting or touching or feeling temperature, you know, you basically are like dead. And to see these people coming alive when something, some image comes to them, whatever it is, it's so, for me, is very, very exciting. Very exciting.
Yeah, you know, those moments in practice when you're with somebody and they have that experience and you get to share it with them. You know that you're sharing something very, very special in that moment with that person. And I always think about the intimacy of dance therapy, because we do get invited in to experience moments like that not many people get to share with the patients or the clients. And it's very special.
And you know, it's very interesting you mentioned this. We're talking now about smiling, but sometimes when I do the workshops, people are opening up and all of a sudden some trauma memories are coming to them. And I have had people, when I did workshops in Asia and Hong Kong, you know, one particular person shared in the group on the second or third day of the workshop. I usually did like 4 or 5 days workshop straight through every day. And one woman shared that she had a dream at night about somebody infiltrating into her room. And the woman who sat next to her, after this woman shared the dream she had the night before yesterday's workshop and today's workshop, the woman next to her opened up and shared that she actually was raped. And this woman was for 2 years in verbal therapy with my interpreter in Hong Kong, which is a wonderful, wonderful therapist. And that woman never shared the rape experience, whether she couldn't remember it or wouldn't share it. And all of a sudden, after 1 day of movement work, when that woman next to her said, I had a dream, and she got the courage to say, I was raped. My interpreter was in a shock because for 2 years, she sees her every week for a session, and that never came up. and it was all verbal therapy,
Mhm.
right? So the gifts that we can have from the body, that we can alleviate even the traumas. Now we know more about traumas, that the work needs to be from bottom up. But years ago, they didn't know about that.
Right.
They didn't know. So, yeah, so it's
Mm.
very powerful.
Is there a particular patient or client experience that was meaningful to you that you can share with us?
I will choose some that are kind of short, so we don't
Sure.
stay here for a whole week, right? So
Or we can.
I used to have in Palo Alto, where I live in California, I used to have a group of 10 people, the same 10 people, that used to make a commitment for 10 sessions. After the 10 sessions, if they want to continue, they make a continued commitment for 10 more sessions. So basically for 10 sessions, they were the same people. And I was lucky that the VA hospital gave me the day room in the evening to do my work. So all the people around were patients who were locked in at night, but we did the work we did. And I did the work with the people the usual way I do dance therapy. I start from warm up, and then I develop it from picking up the movement and adding music, and whatever comes, right? So one day, a woman, in the middle of the session, everybody is dancing their own individual dance and they move at the same time. A woman stopped a minute and said, "I'm going to scream, don't get scared." And she just bent down and she screamed. It was very scary, but because she told us, the people continued to move, each one in their own trance dance, and she screamed. And when she finished screaming, she continued to dance. So I used to run 2-hour sessions. In the beginning, they would say what they want to work on, each person, and I would weave what each person want to work on into the whole group. And then I did about 45 to 50-minute session, and then they shared what happened to them. So that was the structure. And when she shared, she said that she is going to visit her father, who lives in New York, and we are in California. And she never told him how she felt about him and her relationship with him. And after she screamed, she decided that she's going to visit him next weekend anyway, and she will choose to share. I suggested, why don't you tell him all the things that you bottled up for so many years? So she did. She went to New York, she came back, and she told us in the group that she shared with her father a lot of very painful stuff that she was bottled in for a long time. And what she didn't tell me, that she had low thyroid. So she was on low thyroid medication for several years. And she had a follow-up with her doctor, and she went to the follow-up, and her doctor did the test, and her thyroid was back in balance completely. So they stopped her medication, and she continued in my group for several more months, and her thyroid never went back to low thyroid. So she just kept it all in, the connection between the glands and the psychology and the body. And after she screamed and after she shared with her father, her glands started operating fine, which was for a long time. She stayed in my group for a very long time. So we had lots of follow-up. And that was amazing to me. Amazing, you know. So this is like 40 years ago, before they had all the mind-body connection that they now say in research. But at that time, there was no research. And we were dance therapists who kept saying that there is a connection, there is a connection. But people didn't quite listen to us, you know. Now we have all these researchers backing us, which is really, really nice. So this is one example. There's many more examples, yeah.
Yeah, it really speaks to the power that we kind of innately know in the field of the body-mind connection, that research is kind of catching up to dance therapy
Right,
versus the other way around.
right, exactly, exactly.
Mm.
You know, there's a lot of things. Like there was another example, which is very short. When I did my 10 sessions, the first session, I didn't know anything about anybody's background. And I did the session, and one woman was walking around the room, the extremities of the room, the whole 45 minutes. This is what she did. This is all she did. So I'm watching and seeing, no matter what I suggest, she doesn't connect with anybody. She doesn't go in the middle of the room. She doesn't go from one end of the room to the other end of the room to go through the middle of the room. She just circles the room again and again for 45 minutes. And then when we sat down to share, she said, I had a wonderful experience. I realized, and it's very, very clear to me, that I need to leave my marriage. I'm clear in one session. And she went home and she was very miserable in the marriage. And she told her husband, I want a divorce. This is after one session. It was unbelievable. So it's very, very powerful what can happen in movement, you know. I mean, there are many more examples because I've been working for so many years.
Yeah, I love this connection that your memories or your stories about your patients are kind of connecting back to what you said earlier, which is that a lot of times, particularly back in the psychiatric hospitals, you know, before medications and
Yes.
when people were kind of tucked away on the back wards, people don't have a connection to their body.
Yeah.
They kind of have this dissociative quality of not being embodied.
Right.
And that is the power of what we do, that when you support or facilitate or help or witness
Yes.
somebody being in their body,
Right.
then change can shift, and it can shift very quickly, like you're sharing.
Right. Yeah. And you know that the what I learned about observing is so important, because you have to observe very closely, even if you have no understanding why somebody is repeating the same thing again and again and again in a workshop. You know, so there was when I did a workshop in Hong Kong, I did it actually 2 days in one room, and then we had to shift to another room because of the facility. So there was about 40 people in the room. I knew nothing about anybody's background. And there was one woman that, regardless which room we worked in, which movement session we had, it was 4 days. So we had a minimum of 8 to 10 sessions of an hour long, you know, and then sharing experiences. And all the time she was sitting on the floor, someplace in the room, looking outside a window. That's it. So I asked my interpreter in Hong Kong, who is a wonderful therapist, and I said, do you know anything about this woman? Did you notice that for 4 days, regardless which room we are in, regardless what I'm leading, what I'm suggesting, she sits and looks outside? And my interpreter said, I know nothing about her. So finally, on the last day, when people shared experiences, she said that I want to share something that I did here for 4 days. She said, I know I was sitting all the time with the back to the group and look out the window, and I know what it's about, and I want to tell everybody that I'm planning to leave Hong Kong and move to Europe. And everybody in my family, my friends, they tell me I'm crazy, that I shouldn't be doing it. And I feel like a traitor by wanting to move away from Hong Kong. And this is what it meant. So she said I had to practice looking outside and trusting myself that my decision for me is the right one for now. I was like in a shock. The interpreter was in a shock. And every day I told the interpreter, look at her. She's still looking through some other window. She never faced the group. She never antagonized anybody. She never joined anybody, regardless of my suggestions. And she continued to work on having courage to do what she decided is good for her in her life. Very powerful. So in that way, you know, it's like your body is your friend. Your body really gives you the courage to do certain things that verbally you cannot convince people that this is who you are and this is what is good for you for now. So she needed the accompaniment and the encouragement from practicing her body, looking outside, looking outside, looking outside. And it was totally amazing for me. Yeah, very powerful.
You just observe to witness. You don't observe to necessarily understand what you're seeing, right? But just to bear witness to it, and it'll come through. Like at some point you'll understand, or the person who was experiencing it will share that with you, or the pieces will come together. But we observe just to be present and witness, and it's okay if we don't know what we're observing. I think that's a really important point.
And sometimes the people during, especially 2 or 3 or 4 days of workshop, they get the meaning during the 4 days or 3 days. But sometimes they get the meaning later, you know? So I had some people, there was one lady who sent me a whole poem and song that she wrote. She sent me with a link from Asia after the workshop, that she made meaning of what happened to her in the workshop. It was unbelievable. Yeah, and this is how I enjoy doing therapy, that you open a process and the process needs to continue. You don't close process. Even when I do only verbal therapy with my clients, I'm still working. I try always to end the session with something open. I don't kind of patch it, you know, and put a ribbon on it. I leave things open so that the mind and the body and the spirit remains open and the process continues. And I encourage people to continue to allow the process to be there.
So this next one is a bit large and loaded, but you can kind of respond as you would like. I'm wondering if you could share a little bit about what you would say the essence of dance therapy is as you understand it from your mentors.
Well, the essence for me is that the body is our best friend, that the body is holding all our history, that the body has very important memories, whether they're good memories, bad memories, you can label them as you want. They're memories that are part of your life, that regardless how somebody chooses to label it, I think that there is no negative memories as long as you can use it for your processing your life and to learn from it. And I think that we need to love what the body gives us. And sometimes the body gives us pain, but pain is sometimes a message that tells us something is wrong. Please pay attention to me. And I really look at it that any information from the body are gifts that we get from the body. And with gifts, you know, it's important to learn how to accept gifts. Sometimes you get a gift that you look at it and you have no use for it, or you don't like it, or the color is not the color you like. But we have to learn to accept gifts in the form that the gifts are given to us. And how we use it afterwards is up to us, you know. So I think this is the essence. I think I think working in dance therapy is, the essence is a discovery of who we are. Because I really believe that none of us know who we are, that we all know some parts which were encouraged and developed by our environment, by our family, by our teachers, by our friends, by whoever, and some parts were not developed.
Mm.
And I think that if we allow the body to open, we find more parts of who we are.
Mm-hmm.
So it's a process of discovery and exploration. And exploration for me is very exciting,
Mm-hmm.
no matter what content. And I don't put labels on it. I just look at it. Wow, look what I discovered. This is what I found, you know?
Mm-hmm.
So I think this is, we need to accept it with love and with attention.
Mm. And I'm sure that came from like a mixture of all of the learning that you've done. So if I say, I'll name each of the four women that you've studied with. So what would you say in like one small phrase perhaps would be the essence of Chace?
The essence of Chace is observing and connecting and discovering and utilizing
Mm-hmm.
and allowing and allowing.
Mm-hmm. And the essence of Shoop?
Accept the diversion, the intensity, the power that comes from inside of you.
Mm-hmm. And the essence of White House?
Allowing the gentleness of your body to give you the music and the harmony.
Mm. And the essence of Hawkins?
Creating a structure within which you can find freedom to be.
Mm. Beautiful, beautiful. So you, I'm sure, have seen the practice in the field of dance therapy shifting and changing over the years that you have been a dance therapist. And I wanted to ask, what about your knowledge, your practice, your experience would you like to see carried on to future dance therapists?
Yeah. I think that one thing that is very, very important and that I am afraid has been subsided recently is that that people who go to this field really need experience in many, 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 many different forms of dance. Many different forms, because it's almost like in sports, you know, every particular sport develop or uses certain muscles in the body. And I think that every particular dance form is allowing different parts of the body and the soul to develop. And I think if somebody only studies classical dance, their movements and their ability to express is going to be very limited, unless they are in a company that focuses only and uses only classical dancing. Okay, even within modern dance, there's so many different styles of modern dance that I think that each one of style of dancing that you experience allows you and helps you find parts of yourself that are different, using muscles differently, using your expression and discovery differently. There's no question in my mind about that. And I can share with you in one of the workshops I did in Shanghai, that was 4 days workshop. I didn't know anything about the participants. And after 2 days, a woman came over to me and she told me very quietly that she's a professional dancer. And she said to me, after 2 days in this workshop, I realized that in order to really experience what you're doing, I have to forget everything I learned in classical dancing, classical ballet. So she came to me afterwards. She consciously, she said, I have to forget all that I learned and I have to open to be in a different way. So it was really difficult for her for the first 2 days because she was used to first position, second position, third position, and Gram Batman and all this. And it was difficult for her to flow. I didn't follow up more and more the acceptance conditions for dance therapy programs. But when I submitted my application, it was very clear that each one of us had to have experience in as many dance forms as possible. So if somebody came only from classical ballet, I don't think they were accepted to the course. I just had a wonderful ride and a wonderful experience, partially because it didn't exist. So I had to discover, and I had to have the passion. And I think that it's very important to have passion in what we're doing in general in life, but especially when we're doing something that is connected to the body. Yeah. And especially when you're doing something that is about the body expression of who you are and of oneself and how you connect to others. Yeah.
Great.
Very crucial.
Very crucial indeed. Yes. So to close our time together, I would love to invite you to just share a little movement with me, if you wouldn't mind. Okay. Just maybe a minute of movement. You can stay seated. That's no problem. You can, I'll just be here to follow with you, if that's okay.
So you want me to start the movement?
I do. I would love for you to start the movement. I'll just follow along. I'll just be present with you. I'll move with you, but
okay.
Yeah.
Okay.
Dr. Nitza Broide-Miller, I would like to thank you so much. This has been an amazing experience and conversation. I'm just beyond thrilled to have had the time to connect and talk with you. Thank you so much for everything that you shared.
Okay. Well, thank you very much for including me in this important thing that you're doing.
Well, I really appreciate your time.
Thank you so very much. Thank you.